Great. Well, delighted to have this opportunity today to reflect a little bit on how the care sector engaged in the National Day of Reflection for COVID-19. This happened this year on the 8th of March in 2026. And I'm delighted that we've got a couple of guests with us today who are going to be able to tell us about some of the things that they're aware of that happen within the sector, and also a chance for us to think about how we can continue to support those across the care sector who are wanting to take the opportunity to reflect and think about COVID-19 and the impact it had on the workforce and people drawing on carers. So my name is Vic Rayner. I'm the Chief Exec of an organisation called the National Care Forum, and we're delighted to be doing this webinar as part of the Care Provider Alliance and as part of some work that we've had supported by the DCMS around their work on the National Day of Reflection. So I have two guests with me today. I have Neda Zirabi from the department and Mike Butler from the National Activity Provider Association, which is Mike. So I'm going to introduce both of those in a minute and give them an opportunity to tell us a little bit about what they've observed and what they're aware of has been happening across the sector and more nationally. So if I start with you, Neda, can you tell us a little bit about your role, the work that you've been doing within the department, and your sort of reflections on the 8th of March? Over to you.
Thanks, Vic. Hi, nice to meet you. So I'm Neda Zirabi. I work in DCMS in the COVID commemoration team. I've been there for just under 2 years. And in terms of the Day of Reflection, this year we saw a range of activity take place all the way across the country, across a number of sectors. So we saw events being run by local councils, by care homes, by a range of different sort of sectors, so youth groups, focus on key workers, young people. A couple of the staff in our team also had the opportunity to go along to some of the events across the country, which was great to see. They ranged all the way from the unveiling of new memorials, whether that included sort of benches, plaques, cherry trees planted, all the way through to sort of speeches and commemoration services. So we saw a huge range of events take place, and it was a really wonderful occasion to sort of see it marked in so many different ways that meant so much to people in different ways. So yeah, that's just the flavour. I think we also had a national events map on our website, and we saw about 215 events all submitted to that map, which was fantastic. Obviously, that doesn't necessarily say that that's the total number of events. I'm sure there is a lot more out there, but it was great to see nonetheless that such a large number was submitted, and it gave us a flavour for just some of the different types of events that were happening, including from the care sector. So yeah, that's just a small flavour, and we had sort of ministers from all the devolved nations go out to a couple of these events as well, which was great to see. So yeah.
Thank you. That's really interesting. So as you say, it's fascinating to see this sort of breadth of different activities, and I'm interested in some of the ones that you picked out there. So you talked about trees, planting of trees, and benches. And I know I was particularly moved a number of years ago when I joined some of the commemorative activities that were carried out by the NHS Together, the NHS Charities Together work, who were acknowledging the work of both care and health workers and the impact COVID-19 had on them. And that was held at the National Arboretum, and that's an extraordinary place. I'm guessing that there were some activities that happened there as well.
Yes, I believe so. I can probably speak to some colleagues to get more information about that, because I think one of my colleagues actually went along to some of that. But yes, we saw sort of events from NHS charities together, who also DCMS is working with alongside Forestry England on a new kind of memorial scheme across sort of England's forests, as well as potentially in sort of hospital sites in areas where we saw a disproportionately large number of sort of cases around the pandemic. So yes, we've seen a huge range of sort of activity, and for people who are interested in finding out about some of these events, they can visit sort of our as I mentioned, events map, which includes details of all of those different types of events, which includes sort of links to different organisations' events and the details. So yes.
Yes, and I think that sort of sense of being outside and that providing a kind of suitable space. And you mentioned cherry trees being planted, and I think that benches for people to sit on and reflect, and that's quite interesting. That becomes such a kind of dominant theme, actually. I think, having been to some of the kind of working group discussions as well, the use of outdoor space and how that's delivered, and of course that creates a real opportunity for the care sector, particularly in residential space, because that means there are opportunities to think about that. So let's come back. I've got some details of some of the things that care organisations were doing. So I'll be interested in your thoughts about how much they line up with some of the other options that you heard, or whether there's things that we can sort of elevate and take forward. Mike, you've done a great amount of work in NAPA to help care organisations and activity providers, particularly, to prepare for this and to give them some really helpful detail about the sort of things that they might engage with. Did you have some feedback from members, or have you got some observations from those you talked to about the things that have worked, or the things that people wanted to do but weren't able to for whatever reason?
Yeah, so hi, sorry, I'm Mike from the National Activity Providers Association, as Vic said. We produced and developed a day of reflection toolkit, as you know, Vic, that went out prior to the day of reflection. And this was basically to help providers to mark the day with what felt meaningful, thoughtful and appropriate for them, really, for the individuals that they were supporting. And we wanted it to be practical and accessible for everybody, something that teams could just pick up and adapt to their setting. We have seen quite a lot of reminiscence activities that people have been sharing, but a lot of reflection as well. So a lot of people have been sort of taking the time to create quieter spaces in their care homes and services to actually provide, quieter areas where people can reflect. But equally to that, we've seen a lot of intergenerational work as well. People sort of bringing the children in to discuss their experiences and see how they compare and things. So yeah, there's been quite a lot of activity. People focused a lot more on sort of the activities that were individual, because I think they wanted it to be more sort of person-centered, which is understandably when you're reflecting on things like that. But there was a lot of people also joining forces to create more group activities as well. So it was, I think, I don't know if it was because obviously, during the pandemic, people were kept separated. And I think it was a time to bring people together to discuss how they were feeling as a collective as well.
Yes, you forget just how much time people had to spend on their own, and that wasn't a positive experience for people generally. So I think I can completely understand why people wanted to get back together. So we've had a bit of feedback from a number of organisations about the things that they were doing, and they chime quite a lot with both what you're saying, Micah, and Neda. So one of the organisations who came back were talking about doing a memory tree. That's quite a valuable thing to do. I think activity providers are often instigators of memory trees for a range of different activities, but I think that idea that that combines both, doesn't it? That opportunities for some very personal reflection, and then but sort of acknowledging that there will be some shared experience of that by hanging it on a tree. But that's, Mike, I'm assuming that's something that's pretty familiar to lots of activity providers, but good to use in this situation.
Yeah, absolutely. They use sort of the memory tree idea and things like that as a way of collecting the information from individuals, but also having it displayed within the care home as well, so that people visiting or family members or even other individuals and residents can actually see the work that's been done. And it also creates memory trees also create like a talking point for people as well. So even if you're just walking past, it keeps that conversation going. And I think that's an easy way for people to sort of engage with moments like the day of reflection and other things as well.
Yes, and a sort of an extension of that idea, or an alternative option that's been fed back to us, is sort of a memory table with photo, where you can put photos and things that connect with you. And I know often when people are thinking about that with COVID, they're putting masks and testing boxes and those sort of things, but also some of the fun things that people did do during the COVID period that perhaps they haven't gone back to, some of the sort of shared outdoor activities. There was a lot more focus on being outdoors because that was seemed to be a safer space to be.
Yeah, we also saw, like, the clap for carers, that was sort of mentioned, on some posts that they reminisced about, the clap for carers and stuff like that. But also different bits and pieces that they'd done outside, because the outside activities were all they could do. So again, it was, bringing nature in to a certain point for people that were cared for in their beds and bedrooms and things. People that were unable to get outside, how they could, revisiting the ways in which they brought those activities from the outside in. So there was a lot of different ways in which people did engage with it and brought that back to the forefront.
Do you think it almost created a bit of a permanent shift in terms of how we think about working with people? Because people had to be your colleagues are always incredibly creative, but people had to be that much more creative in terms of thinking about how they worked, and also I think how they brought technology into services in different ways to connect people, and those things have in lots of cases continued, haven't they?
Yeah, I think it definitely has changed the way in which, activities are now delivered. People look back and as an activity provider during COVID, you do have to adapt to different things, and you have to constantly be thinking about, we need to do it this way, or should we bring this to the person instead of taking the person outside, and I think the way in which we do things now has definitely been set out from COVID as different ways. We've all learned that different adaptations of things work, so why not, keep them going? But I think it's also made people think a lot more that people don't necessarily always want to be around other people. And I think that's a good thing as well, because people have also, I think it's allowed for person-centered activities to, again, remain steady and focused on the individuals rather than a one kind of activity will fit all. And I think that's really, really focused from the pandemic as well.
Yeah, and I'm just thinking the sort of explosion of online resources that came through then. So online sort of sessions to either connect people or in groups, particularly thinking of places like retirement villages where socializing is one of the sort of key attractions. So being able to bring people who are perhaps isolating in their individual flats to have a chance to sort of be part of the same exercise class or whatever, and see each other on the screen, or sing together, or those kind of things. And I think it's important to remember that the care sector was very, very engaged in those ways of working, and that learning continues.
Yeah, I mean, a lot of people didn't really understand technology that much during COVID, and I think it was the fact that it was the only way that you could deliver some activities. So I think people had to learn, and they had to learn very quickly. but I think there's always people in those care services and care settings that can come together and support other people with the delivery of that. We know of, some activity coordinators that aren't very tech savvy at all, but they produce some of the most wonderful activities through COVID, incorporating tech, because they've had the help and support from their colleagues and other people as well. So I think definitely tech is, something again that people are going to be using a lot more moving forward, not just through the pandemic.
Yes, thank you. And I mean, some more traditional ways as well. Maybe, I don't know how much time you've spent in the care sector and in care homes, but cake is always a fundamental part of many activities. So I know people who are putting together sort of just an afternoon tea, but within that, taking a chance for a minute of silence or a moment of reflection or something that's not going to force people to have to engage in a particular way, but does note it. So I think some of those more sort of underplayed moments are equally important as well. And we have in our membership a lot of faith-based organisations, and I'm aware of members who within their services or within any kind of Sunday worship that they might have had on the day itself brought that in, but also they quite often might have some sort of service that they do on an annual basis where they remember people who they've lost over the period of the year. And I think a chance to incorporate the day of reflection or thinking about that period of COVID into those is another way that organisations have done it. I had an interesting conversation. I was visiting a member the other day and they were talking to me about their memory box that they had created during COVID, and that they had made it into a time capsule, and it was underneath the floor. So while we were speaking, it was under the floor, and they were reminiscing about the things that were in there. So that becomes a talking point, even for people who haven't been in the service or in the setting during that period. They can relate to, the momentous nature of it. And that was something that NAPA and the National Care Forum did together to sort of work to encourage people to put together that kind of time capsule and the things in it. So it's good to hear that it was in action and something that people still valued. Ned, any of those things that Mike's talked about stimulate any thought about other things you've heard or ideas?
Yeah, absolutely. So just as you were speaking there, Vic, it made me realise just how much similarity there is across the sectors. So it was really reassuring to see actually this year that there wasn't just sort of a focus on organised planned community events. It was very much a full range of activity, and it could have been as small as sort of going to your local place of reflection on an individual basis. It didn't necessarily need to be sort of organised activities in the sense of sort of big community events, but we saw a range of different sort of events taking place. So people going to their local memorial sites, as you mentioned, sort of memory walls, memory boxes, new oral history videos sort of published, things that don't necessarily take sort of much funding and don't need a lot of planning time, which was really lovely to see actually. As Mike, you mentioned, a lot of new online resources that we've seen sort of published, from toolkits to sort of webinars, to sort of pamphlets for how people could get involved next year, different ways they could get involved specific to their sector, or sort of sharing best practice, which we've seen a lot between local councils, which was really reassuring to see actually that different local areas are speaking to each other and sort of sharing their plans. So I don't think there was sort of a one-stop shop or one way of doing this. It's very individualistic. It's very sort of different for each area and their own specific experiences. So a lot of the different types of activities that you've already mentioned, we've not just seen across the care sector, but across a number of other sectors. So I think also, Vic, you mentioned where organisations are already carrying out annual activities and where they've sort of adapted those services to meet the day of reflection. We saw a lot of that also, not just across the care sector, but also healthcare, NHS. So for example, the NHS have talking cafes that they do on an annual basis anyway, and we saw a lot of those types of services adapted to cater for the day of reflection, so people could go there not just for sort of their to grieve in the general sense, but also specifically around the pandemic. So we saw a number of sort of existing services adapted in that way to cater to sort of people's needs around that particular day. So it was really wonderful. And yeah, a lot of what you've said has resonated not just across the care sector, but we've seen that across a number of other sectors. So it's really reassuring actually to see there are a lot of similarities, but also there isn't just one right way of doing this. It really is depending on sort of how people want to mark the day for themselves and for their communities.
Thank you. Yes, that's great. And I think that's really important, that it's a combination, isn't it? A very person-centered, individual, group, physical, plaques, natural resources, trees, plants, gardens, photographic stimuli, things, online stimuli. It's really important, isn't it, that people who want to do this get a chance to do it in the way that's important to them. So I just want to thank both of you for just giving us a bit of inspiration and perspective on what's been happening and some of the things that people could do. We'll share again the brilliant resource that you created, Mike, and you and your teams, that will share that and links to the map so people can look in and decide what they want to do. And it's not too late, of course, is the other message. Just because the day itself has passed, still an opportunity to think about these. And Neda, do we know if there's a date for next year? Any plans for the future?
We do. So we've got the date for the next 2 years now. So next year's will be the 14th of March. So normally what we try and do is do the first Sunday of each March, but because it coincides with Mother's Day next year, we've opted for sort of the second Sunday. So we've sort of published that date online. But again, we're very happy to sort of work with different local areas on any advice they need or any resources they'd like us to sort of cascade and promote through our own networks. But we'd be very happy to sort of hear from your sectors on how you would like us to sort of work better with you in future, and sort of any learnings you took from your events this year. So yes, what we'll do, we'll also update our website each year, and Mike, there might be something around us working together to potentially promote some of the resources from your sector as well as other sectors where there are things like toolkits, for example, that might be useful to put on our website. It's also worth noting we have separate web pages just generally dedicated to COVID commemoration that's set on Gov UK, and we use those to pull together things like oral histories and details of all memorial sites across the UK. Those are separate to our Day of Reflection website, but we are trying to sort of be as helpful as we can in collating somewhere centrally a whole host of information like that, educational resources around the pandemic. So those are also other resources that we have that we can sort of share with your networks where those would be helpful. But yes, so we've got the date for next year, and it will be very similar to this year in the sense of sort of it is really up to sort of sectors on how they want to run their events, but any support from sort of central government they need, then sort of we are very happy to sort of share our experiences of what we've seen this year and what might be helpful. But it's been really, really reassuring to sort of see a whole range of different activities take place this year. And, there is sometimes a worry that, with the 6th year after the sort of 5th anniversary, we were almost worried that there wouldn't be as many events. And obviously that's completely understandable if that is the case. Sort of people want to mark it in their own ways or potentially not mark it. It's still very raw. But just seeing the number of activities that did take place this year was just really wonderful and really quite moving and touching.
Thank you very much. And I think, I think it's been very important to have this focus on it. And huge thanks to both of you and to colleagues from the Care Workers Charity who joined us on our previous webinar, and who I know were putting forward their a memory wall for people online, memory wall for people to put comments on, and that remains open. So people, if they want to share thoughts and memories of previous colleagues. That's another space, and that will continue. So thank you both, and great to have the opportunity to talk about what's going on, what people have done, and how they've taken the opportunity to mark this difficult day, but an important day to remember, an important day to reflect on the impacts on those drawing on care and sport and working in the care workforce. So thank you both for your time. Thanks.
Thank you.
Thank you very much.